If you or someone you know has ever struggled with depression, anxiety, or other mental health issues, you may have heard of Zoloft. This prescription medication is one of the most commonly prescribed antidepressants in the United States and is often used to treat a variety of mental health conditions. But what exactly is Zoloft, and how does it work in the brain? And what are its potential side effects and risks? In this video, we'll dive into the science behind Zoloft, exploring how it affects neurotransmitters in the brain to alleviate symptoms of depression, anxiety, and other disorders. We'll also discuss some of the potential risks and benefits of taking Zoloft and provide some tips and resources for anyone considering this medication as part of their mental health treatment plan. So whether you're a healthcare provider, a patient, or just curious about the science of mental health, join us as we explore the fascinating world of Zoloft. How Zoloft works in the brain. Zoloft is a selective serotonin reuptake inhibitor, SSRI, that works by increasing the levels of serotonin, a neurotransmitter, in the brain. Serotonin is responsible for regulating mood, sleep, appetite, and other bodily functions. People with depression and anxiety disorders often have lower levels of serotonin in their brains, which can lead to symptoms such as irritability, sadness, and difficulty sleeping. Zoloft works by blocking the reuptake of serotonin, meaning that more serotonin is available in the brain to regulate mood and other functions. Zoloft is believed to work by specifically targeting the serotonin transporter protein, which is responsible for reabsorbing serotonin into the presynaptic neuron. By inhibiting this protein, Zoloft increases the levels of serotonin available in the synaptic cleft, the gap between the neurons where neurotransmitters are released and received. This increase in serotonin levels is thought to improve mood and alleviate symptoms of depression and anxiety. It's important to note that the exact mechanisms of how Zoloft works in the brain are not fully understood. While it is known to increase serotonin levels, researchers are still studying the specific ways in which it affects brain function and how this relates to mental health conditions. Common uses for Zoloft. Zoloft is primarily used to treat depression and anxiety disorders, including generalized anxiety disorder, GAD, obsessive-compulsive disorder, OCD, panic disorder, post-traumatic stress disorder, PTSD, and social anxiety disorder. It is also sometimes used to treat premenstrual dysphoric disorder, PMDD, a severe form of premenstrual syndrome, PMS, that can cause mood changes, irritability, and other symptoms. Zoloft is typically prescribed as a long-term treatment for these conditions and can take several weeks to start working. It is important to continue taking Zoloft as prescribed, even if you start feeling better, to avoid relapse. Possible side effects of Zoloft. Like all medications, Zoloft can cause side effects. Common side effects of Zoloft include nausea, diarrhea, insomnia, dizziness, and dry mouth. These side effects are usually mild and go away on their own within a few days or weeks. However, Zoloft can also cause more serious side effects, including suicidal thoughts or actions, especially in children and young adults. It is important to monitor your mood and seek medical attention right away if you experience any new or worsening symptoms of depression or anxiety, such as thoughts of self-harm or suicide. Other potential side effects of Zoloft include sexual dysfunction, weight gain, and increased risk of bleeding. Some people may also experience withdrawal symptoms if they stop taking Zoloft abruptly, including dizziness, headache, nausea, and irritability. It is important to work with your healthcare provider to slowly taper off Zoloft if you decide to stop taking it. Precautions and considerations when taking Zoloft. Before starting Zoloft, it is important to discuss any medical conditions or medications you are taking with your healthcare provider. Zoloft can interact with certain medications, including blood thinners, nonsteroidal anti-inflammatory drugs, NSAIDs, and some antidepressants. It is also important to let your healthcare provider know if you are pregnant or breastfeeding, as Zoloft can pass into breast milk and may harm a nursing baby. Zoloft may also increase the risk of suicidal thoughts or actions in children, teens, and young adults, especially during the first few months of treatment. It is important to monitor your mood and seek medical attention right away if you experience any new or worsening symptoms of depression or anxiety. How long does Zoloft take to work? Zoloft typically takes several weeks to start working, and it may take up to 12 weeks to see the full benefits of the medication. It is important to continue taking Zoloft as prescribed, even if you do not notice immediate improvements in your symptoms. It is also important to work closely with your healthcare provider to monitor your symptoms and adjust your dosage as needed. Dosage and administration of Zoloft. Zoloft is typically taken once daily, either in the morning or evening, with or without food. The dosage of Zoloft will depend on the condition being treated, as well as other factors such as age, weight, and medical history. It is important to follow your healthcare provider's instructions for taking Zoloft and not to adjust your dosage without consulting with them first. Zoloft and mental health conditions. Zoloft is primarily used to treat depression and anxiety disorders, including GAD, OCD, panic disorder, PTSD, and social anxiety disorder. It is also sometimes used to treat PMDD. Zoloft works by increasing the levels of serotonin in the brain, which can improve mood and alleviate symptoms of these conditions. It is important to note that Zoloft is not a cure for mental health conditions and should be used as part of a comprehensive treatment plan that includes therapy, lifestyle changes, and other medications if necessary. Zoloft can be effective in reducing symptoms of depression and anxiety, but it may not work for everyone. Alternative medications to consider. Prozac, fluoxetine. Prozac is another SSRI commonly prescribed for depression, anxiety, OCD, and other mental health conditions. It works similarly to Zoloft by increasing serotonin levels in the brain. Prozac is available in various strengths and has a longer half-life compared to Zoloft, which may result in fewer withdrawal symptoms during discontinuation. Lexapro, escitalopram. Lexapro is also an SSRI that is often used to treat depression and anxiety disorders. It works by increasing serotonin levels and is known for its relatively low side effect profile. Lexapro may be a suitable alternative for individuals who have not found adequate relief with Zoloft or have experienced side effects. Effexor, venlafaxine. Effexor is a serotonin norepinephrine reuptake inhibitor, SNRI, that works by increasing the levels of both serotonin and norepinephrine in the brain. It is commonly prescribed for depression, generalized anxiety disorder, GAD, and social anxiety disorder, SAD. Effexor may be an option for individuals who have not responded well to SSRIs alone. Wellbutrin, bupropion. Wellbutrin is an atypical antidepressant that primarily affects the neurotransmitters dopamine and norepinephrine. It is often prescribed to treat depression and may be considered as an alternative for individuals who have not responded to SSRIs or have experienced side effects such as sexual dysfunction. Cymbalta, duloxetine. Cymbalta is an SNRI that works by increasing the levels of both serotonin and norepinephrine in the brain. It is commonly prescribed for depression, anxiety disorders, fibromyalgia, and chronic pain conditions. Cymbalta may be beneficial for individuals who experience both depressive symptoms and chronic pain. Alternatives to Zoloft for mental health treatment. While Zoloft is one of the most commonly prescribed antidepressants in the United States, there are many other medications available to treat depression and anxiety disorders. These medications work in different ways and may be more or less effective for different people. Some alternative medications to Zoloft include other SSRIs, such as Prozac and Lexapro, serotonin norepinephrine reuptake inhibitors, SNRIs, such as Effexor and Cymbalta, tricyclic antidepressants, TCAs, such as amitriptyline and nortriptyline, monoamine oxidase inhibitors, MAOIs, such as Nardial and Parnate. It is important to work with your healthcare provider to find the medication that works best for you and to discuss the potential risks and benefits of each medication. Conclusion and final thoughts. Zoloft is a commonly prescribed antidepressant that works by increasing the levels of serotonin in the brain. It is primarily used to treat depression and anxiety disorders and can take several weeks to start working. While Zoloft can be effective in reducing symptoms of depression and anxiety, it can also cause side effects and may not work for everyone. If you are considering taking Zoloft, it is important to discuss the potential risks and benefits with your healthcare provider and to work closely with them to monitor your symptoms and adjust your dosage as needed. Zoloft should be used as part of a comprehensive treatment plan that includes therapy, lifestyle changes, and other medications if necessary. If you or someone you know is struggling with depression or anxiety, it is important to seek professional help. There are many resources available, including therapy, support groups, and hotlines. Remember, you are not alone, and there is help available. Thanks for watching.